Good morning, everybody. Wow, it's amazing to see such a full room today. A big thank you for joining us this morning at Annabelle's. I'm Francesca Ogiman-White, and I'm the founder of the Beauty Triangle. Now, this morning we're all gathered here today to discuss healthy weight loss. And I think that really means understanding the role that hormones, skin support, and also surgery can sometimes play in that whole equation. After all, I'm sure we'll all agree that you reach a certain point in life, and sometimes diet and exercise aren't really hitting the sides anymore. Our hormones start to play up, and our self-esteem can really take a hit. So this morning, we're going to be looking at how to better embrace body confidence, whatever that road might look like to any of us here. Now, when we started the Beauty Triangle, it was to educate and empower our audiences on all aspects of their health and well-being, and critically to us, always from a holistic standpoint, which is why you'll always find 3 panelists on our discussions, each of whom is an absolute specialist in their area of authority within wellness. But we also wanted to break down barriers towards pursuing wellness treatments and really have the conversations that were going quite unspoken out there in the public domain. And in doing so, introduce you to the people that can help and ultimately help you make those safer and better informed decisions. On that note, it gives me great pleasure to introduce today's brilliant speakers. We're joined by GP and hormone expert, Dr. Martin Galy. We're joined by aesthetic doctor and skin expert, Dr. Ana Mansouri. And finally, consultant facial plastic surgeon, Mr. Georgios Orfaniotis. And together we're going to be shining a light on the safer, more sustainable routes to healthy weight loss, whether that's through hormone balancing, GLP-1s, supplementation or lifestyle amends. But we're also going to be unpicking the support that we might need in the aftermath of weight loss, and particularly rapid weight loss. So things like skin optimization, collagen stimulation, some forms of surgery, and even biohacking therapies. There's a lot out there to unpick. Before we get started, just a few things to draw your attention to. You'll find a program at your place setting. You'll find information on all of this morning's speakers there, so you can learn a little bit more about them. You'll also find a referral card, so if you'd like us to connect you with anybody that you hear speak here this morning, you can just leave your name, email, tick the box next to their name, and we'll connect you. We have time for audience questions at the end, so we'd love to hear from you if you have any questions that you'd like to ask our panelists at the very end. And finally, I'm sure you've all seen it, but we have a wonderful, I would say goodie bag, but we didn't use goodie bags for these. So we have a wonderful skin firming treatment from a brand called Volulift. It was developed by plastic surgeons to counter the effects of dehydration, skin aging, and again, weight loss related volume loss. So your face will not forgive you if you leave that on the table this morning. Anyway, that's enough from me. I'm going to pass over to our speakers. They're going to say a quick hello and introduce themselves, and then we'll get started with the main conversation. So Martin, good morning. Thanks for joining us.
Thank you, Francesca. I'm Martin Galy, very pleased to meet all of you and honored to be here, privileged to be invited by Francesca to this really amazing venue. Another reason really to be happy here, the last event we did, audiences here seem really engaged when we speak. So I'm really looking forward to this one. As Francesca said briefly, my background initially was in GP, but about 25 years ago, I realized that a big part of maintaining wellness in GP land was about being able to advise women and men about hormone optimization. And part of that journey led me about 5 or 6 years ago to include weight management in my practice, specifically around the area of GLP-1 agonists. So as we go on today, we will be able to hopefully answer a lot of your questions about both of those areas.
Amazing. Thank you, Martin. Excited to have a chat with you. Anna, thanks for joining us as well.
It's a pleasure. Thanks for having me. So I'm Ana Mansouri. I'm a medical doctor by background, and I've got an aesthetic clinic in Edgbaston, Birmingham, where we really specialize in the undetectable, really tasteful and natural treatments. And I'm very passionate about combination therapies, where you do a little bit of many different modalities so that it comes together in the most undetectable manner.
Beautiful. Thank you. And George, thank you for being here as well.
Thank you for inviting me. It's a pleasure to be here. So I'm Georgios Orfaniotis. I'm a plastic surgeon specializing in facial surgery. I have a background as an NHS consultant doing head and neck cancer reconstruction, and over the last 5 years I'm private doing essentially facelifts. I have a very surgical practice. So I'm excited to be here and hear other alternatives as well. Thank you.
Fantastic. Thanks, George. So we'll get started with the conversation, and my first speaker is Dr. Martin Galy. Martin, you've sort of explained a little bit about what you do, but for everyone in the audience, Martin has long been my go-to guy for hormones. Lots of people I send his way, and I think not just because he gets the bodily chemicals back into a nice state of equilibrium, but they also seem to do wonderful things for our sense of overall well-being and overall health as well, which I think sometimes goes unspoken. But maybe you can tell us, as much as we're here to talk about healthy weight loss, what are the other conditions hormonally that might bring patients to your door?
So hormones, in my opinion, really are one of the main pillars of health for all of us. For women, estrogen really drives your mental health wellness. It maintains your metabolism. It defines how you distribute fat through your body. And it maintains your cardiovascular and bone and brain health. So it's a really very important hormone for women. And as women get older, we all know that estrogen declines naturally. And in the 40s and 50s, estrogen production actually ceases. So that leaves that woman vulnerable to estrogen deficient syndromes. We'll talk about those as we go on. For men, testosterone is the main hormone. Again, it delivers similar protection. For us, our cardiovascular system, our bone health, and our brain health are all linked to testosterone. And unlike women, not 100% of men suffer andropause, but we do decline. Our production of testosterone begins to reduce by about 1% every year for all men. So some men who are fortunate enough to have high T levels in their youth, they can maintain their testosterone into their middle age and old age. But for some men whose peak testosterone are in the lower range of normal, those men can suffer andropause syndrome, very similar to menopause. And then we have on today's topic the whole idea of insulin sensitivity. And interestingly enough, the same decline happens with insulin sensitivity. Our insulin sensitivity outside of hormone decline, insulin sensitivity declines roughly by about 1%, even in weight-stable patients. A very interesting fact from the age 30 onwards. So even in weight-stable, healthy patients who've maintained their hormones, your insulin resistance is worse in our middle age, and hence the reason behind, even with healthy people, the difficulty in maintaining weight the way we used to when we were 35.
And there's definitely a lot spoken in the perimenopausal and menopausal chapter as well. You know, it can be very difficult to keep the weight and maintain the weight in a way that we used to. It would be interesting to sort of unpick that a bit more. I mean, how does hormonal health really relate to weight control? Because you're obviously seeing women at all stages and ages of life, and it must be affecting them and having that sort of interplay in a very different way.
So estrogen, as I hinted before, is really responsible for fat distribution in your body. So when you've optimized your estrogen, the typical female shape where the fat mainly is on the hips and the thighs, is maintained with estrogen optimization. As you lose estrogen, that fat gets redeposited to belly fat, visceral fat, and that has untoward effects on your cardiovascular system.
We always refer to it as the hormonal belt.
Yes, hormonal belt. In men, testosterone also defines where we deposit fat. It also is responsible for muscle maintenance. Muscle is the biggest consumer of sugar in our bodies. So as we get older, and both men and women produce less testosterone, we tend to lose muscle mass if we're not conscious about resistance training and testosterone optimization. So for both of those reasons, visceral fat distribution as we get older gets worse, testosterone production declines, and muscle mass declines, so the consumption and metabolism of sugar, of glucose in our system changes. And that has its own untoward effect on insulin resistance.
It's interesting. Whenever we speak about hormones, you often give this analogy that the body is like an orchestra and it's trying to keep everything playing in perfect synchronicity when it comes to their hormones.
Yes.
And it always strikes me that it's such a delicate balance what you're doing with optimizing with the patient's hormones.
Yes. So men are kind of simple creatures. We have testosterone and you give us back testosterone and we're kind of back to ourselves. Women's hormones really play that symphony. And when all the hormones are in relative normal relations to one another, you get you get the whole orchestral sound playing. The body feels balanced. The mind feels happy. As women get older and the progesterone goes down, estrogen is out of sync. Women begin to complain of a whole string of symptoms associated with that.
And it's interesting because you often say to me that long-term HRT use can actually contribute to better bone health, which we know because of osteoporosis, battling that, brain health and heart health, which is a huge thing for women, I think, as we sort of go through life, isn't it?
Men too. Always remember men too.
Speaking to the 1% in the audience, but no, we're keeping everyone, we're democratic here.
So yes, we have to be equal. So yes, estrogen, very important for bone health for women. In fact, HRT is FDA approved for the prevention of osteoporosis in women. In England, it's a little bit different. HRT is approved for symptomatic relief of menopause, but the FDA in the States have certainly come out very strong against why are we leaving women's bones at risk without estrogen. We now know that there are safe types of estrogen to deliver to women and unsafe types of estrogen to deliver. So a good doctor should be able to explain to any woman asking, is taking estrogen safe for me? The answer is yes, provided we give you the right type of estrogen, the right way.
And I think what you've revealed there is why it's so important that we see an absolute expert in this field, you know, whether we're looking at hormonal optimization or even tripping into the world that you also mentioned, which is weight management. Because if you're going to start sort of bringing these drugs, these compounded materials, these other sort of hormones into your body, you need to know exactly what they're doing, and you need to be under the supervision medically of somebody who also understands that for you. I'd like to touch on the subject of GLP-1s because, as you mentioned, that's been a huge spike in your practice and actually the world at large. I think I read some data yesterday when I was doing some prep for this that 1.5 million people in the UK alone this year are on GLP-1s, which actually I would hazard a guess is almost more than HRT, which seems crazy in a sense. But what do you think is driving this, and who are the patients that you're seeing who are coming and seeking this sort of intervention?
So I think the way HRT changed the health of women around the world, I think GLP-1s are going to change the health of the human population in the future. They are a group of medicines that are game changers in terms of public health. And it's great news that this year the NHS has approved, albeit under really strict guidelines. I mean, the BMI has to be above 35 for NHS patients to be able to access GLP-1s. So GLP-1s, as you all know, act on the pancreas to increase insulin production, and by doing that, it offers a more smooth sugar control when food is ingested. And that's the basis of how it works. Because as I hinted earlier in the talk, insulin resistance, the way your body responds to your insulin to control your blood sugar, insulin resistance gets worse when we go into our 30s, 40s, and 50s. And typically, most people will know that it's not easy to maintain our weight as we get older, despite all our efforts. And most people come in complaining, I used to have no problems consuming 3,000 calories a day. Now I can't even consume 1,000. And I'm in reasonably good shape. I go to the gym all the time, but I just can't control my weight. It's edging up, and I don't know why. So in the old days, we would manage that sort of complaint with HRT optimization for women and men, and perhaps some older type drugs that fall into the group of improving insulin resistance, things like metformin, or if you want a lighter touch, we could use supplements like berberine. But with the launch of GLP-1s about 5 or 10 years ago, we've soon realized that for the majority of people, these drugs offer a window back to restoring insulin sensitivity.
Because you've been sort of working with these drugs for a few years, and it's interesting because obviously their origins lie in essentially treating type 2 diabetes, exactly, but obviously there are sort of long-term health sort of benefits as well in all areas of the body.
Yes, when I first started, I wouldn't forget, my first patient was a young woman with polycystic ovarian syndrome. Of course, these drugs were never mentioned as treatment for PCOS in younger women, but her BMI, she was 32 years old, her BMI was something like 32, her self-esteem was in her boots, she was already on metformin, nothing was shifting. So I took a chance with her because it's off-label use of a drug that was fairly new 5 or 6 years ago. And honestly, the transformation that happened with her within 3 months was a complete game changer. And that's when the sort of, my attitude to those drugs really changed.
I think, look, a lot of these drugs can get touted or sort of labelled as sort of people using them purely for vanity sort of purposes or trying to lose the last kilo or whatever it might be. But I think when you see the impact on someone's quality of life, particularly at that sort of age, that's very powerful. Drawing on that a little bit more, I mean, how do you ensure that you're prescribing medications like these, if they are suitable in a responsible way? And on that, again, how do you also deter people with more unrealistic expectations of what healthy weight actually is?
So healthy weights, it's terrible to come back to the BMI because tall people have high BMIs and they may be really healthy. But we look at the BMI for the average height and we decide there about whether it's reasonable to expect to bring that person's BMI down. Now, what I have to say is that in my practice, even people who appear to be not obese, when they come asking for these medicines, the general population are not unreasonable about their target weights. So when I ask people about what is your target weight, and we calculate what that BMI would look like, generally the public seems to be asking for a BMI of about 19, 20, or 21. Now that's actually an ideal BMI for most people, and even if it's
BMI,
even if it's 3, 6, 8, 10 kilos that they want to lose, I put them on the journey of safe prescribing for GLP-1s because I feel that by getting people back to that target BMI, it not only improves their self-esteem, but it also re-establishes a healthy insulin sensitivity and it gives people back the opportunity to maintain their weight better going forward into the future, even if it means not staying on long-term injectables. So it's important to be realistic. It's also important to be safe. When we want to lose weight, there are target weight losses per month that we don't want to exceed. Excessive weight losses every month could end up losing too much fat from the face, for instance. That's where my colleagues come in to try to help replace that. But with responsible prescribing and not overdoing the dose increases, we can achieve target weight and target BMI without ever drawing fat from the face.
It does have to be that partnership approach,
yes,
I think, which is why stories about people ordering this stuff online and then just, self-administering treatment is a bit scary.
And also, a big part of medicine is about knowledge transfer. So when you impart knowledge about safe use, safe prescribing, target weight, regular blood tests, people soon get the idea that this is a medical journey that they're going on, and it is not just for cosmetics. Excuse me. Because a healthy weight in anyone getting older, for me, again, I've begun to realize, is as important as hormone optimization.
Absolutely, and if we have a lower BMI, obviously inflammation goes down, the body works better.
That's correct.
Everything is far more optimized. I mean, you spoke about some of the negative side effects there: rapid weight loss, volume loss in the face if we lose things too quickly. We know about things like hair loss, which are well documented, gastrointestinal issues. But there are also some more welcome and I think again unspoken side effects, things like the lower inflammation, which is really interesting.
So what we're beginning to see, and there's early research to suggest that whether it's a primary effect of the medicine itself or an effect of the weight loss, we're still uncertain. But there does seem to be an anti-inflammatory effect of these drugs, where people with things like chronic IBS, excuse me again, fibromyalgia, migraine-type headaches, these conditions where there's an underlying inflammatory cause a lot of these conditions seem to be helped and improved by journeys with GLP-1 agonists. So that's early days yet, but it is something that, again, we're looking forward to be able to prescribe for in the future.
Absolutely. And tell us a bit about the split between the patient who's on the GLP-1s versus the HRT. Are most people on both, or does it depend on the reason that they might be on HRT to begin with?
So it depends on what you came to me for in the first place, I guess. So if you came to me because of perimenopause or menopausal-related symptoms, unless weight gain was one of those symptoms, we wouldn't necessarily embark on a GLP-1 journey. But certainly we would have a discussion in that person, that woman, about perimenopause and menopause, about whether it's worth adding something to the HRT prescription to help maintain insulin sensitivity going forward, in the knowledge that it is going to get worse as the years go by. So I tend to have a sort of scale of advice. Women who are at their normal weight and in perimenopause or menopause, I would generally recommend a supplement like berberine to help maintain insulin sensitivity getting older. Women who are maybe between 2 and 5 kilos over their target weight, I would generally recommend metformin to improve insulin resistance in that person. Women or men who are 5 to 10 kilos above their target weight, I would generally have a discussion about GLP-1 agonists.
It has to be that sort of ladder approach, doesn't it? And I was actually going to say to you, what about the patients who are just very anti-injections, who just don't want to be injecting? So I suppose that's where the supplements like the berberine...
and the metformin comes in.
And what is berberine exactly?
Berberine is a naturally occurring molecule. I think we get it in mushrooms, but you'll have to eat about a sack of mushrooms to get a pill of berberine dose every
We should have
day.
had mushrooms on the menu this morning.
Yes. So, again, journeying with the GLP-1 agonists in the setting of HRT for men and women. When I speak about HRT, please remember, in my mind, I'm speaking to men and women in the audience because I treat both men and women with HRT. Always a good idea with GLP-1 agonists to ensure that testosterone levels are optimized both for women and men, because testosterone is what is going to maintain the muscle mass through the GLP-1 journey, alongside things like adequate protein and calorie intake.
Absolutely. And tell us a little bit about the sort of weaning off, because I think that's also a sort of point that people get sort of quite worried about, sort of how to wean off using these medications in a safe and sort of sustainable way.
So remembering when we go on a journey of using GLP-1s, the titration process to the dose that suits that patient is lengthy. It isn't an immediate start that we prescribe the correct dose that you're going to lose the 2 to 3 kilos a month of weight loss. It's a slow process for each patient. We spend the first 2 or 3 months titrating the dose upwards to see at what dose your body begins to respond with about a 2 kilo per month weight loss. We don't want to encourage more than that generally. More weight loss than 2 to 3 kilos a month can spark problems with gallstones, and gallstones can spark problems with pancreatitis, which is the biggest risk with these drugs, that we inflame the pancreas because we are stimulating the pancreas. So the titration to the bespoke dose for each patient is slow. And similarly, at the end, the titration back down is slow. So I have a very slow journey with patients at the end to decide at what point does the body start to misbehave. And by misbehave, I mean at what point does it become difficult again to maintain weight and, get rid of food noise. So food noise is another big relief for patients who go on GLP-1 agonists, and not something I was fully aware of before my journey into these drugs. But when you hear a patient describe life without food noise versus life with food noise, it's like a miracle change for that patient.
It can be light and day. And I think
Light
alcohol
and day.
cravings being lessened as well as another.
So the journey down on the other side, when we decide to come off the GLP-1s, is slow. It's done on a 2 to 3 month review basis so that we can decide at one point, do we drop the injections and transfer back to either metformin long-term or berberine long-term once target weight is reached.
So you're going back down that ladder.
We're going back down the ladder, correct.
And final question on microdosing, because this is something that is beginning to be spoken about in a more sort of maintenance capacity once somebody has reached their ideal healthy target weight. Where do you stand on microdosing?
So the evidence base for that yet is a bit thin, but there is some evidence about long-term microdosing having, again, a positive effect on anti-inflammation in our bodies. And inflammation as we get older is another enemy of insulin sensitivity. So although it's early days yet for that, because we know that serious side effects of these drugs actually occur early in the prescribing journey, not late, unless the doses are really high. We know that the long-term use of low doses of these drugs is fairly safe. If a patient is experiencing benefit in terms of previous symptoms, including food noise, because food noise in itself can be an inflammatory process. So if a patient is experiencing at low dose benefit from microdosing long term, I would probably support that patient, because the downside of removing the support is the return of the inflammation, the return of the food noise, and the return of the risk of long-term illness. So although the evidence is thin, it is something that I support going forward.
It's very interesting how much inflammation comes into this conversation. I think Anna and George, you'll both also probably pick up on inflammation and why it's something that we always need to be vigilant to. But I also love the fact that it sounds like you have such an eagle eye on the patient the whole way through this journey, which I think is the most important thing of all.
So when we talk about bespoke medicine, that is what we're speaking about. The doctor has a listening ear to journey with the patient in a safe way, a safe supervised fashion that we don't run into long-term problems. And when we come to off-label use, it's a journey we take together. So I have this discussion with all my patients if it's off-label using. We are on this together. You're not going to sue me if there's something on the end, because we appreciate the other's support and advice about using a drug that's off-label.
It has to be a partnership, and I think the same applies to all of you up here today. It's that partnership between doctor and patient every single time. Thank you so much, Martin.
Thanks,
Amazing to speak with you as always. So our next speaker is Dr. Ana Mansouri. We've already heard a bit from Anna, but she's an absolute expert when it comes to this sort of aesthetic artistry and collagen-stimulating treatments as well, which we're going to be speaking a lot about this morning. But Anna, maybe you can start by telling us a bit about the patients that you come to see. What are the main sort of skin concerns that they're presenting with at the moment?
Yeah, so we see patients across all of the different age ranges. Most commonly, I would say mid-30s, 40s, 50s. And more often now than ever, we see a lot of post-medication induced weight loss patients. I would say probably about 10 to 20% of my patient base has at some point been on one of these medications.
That's interesting. With the ones that tell you about it anyway.
Exactly.
Not everybody does.
Exactly. And they often complain and notice accelerated facial aging. And there's quite a common denominator of the fact that they have now lost this weight and they're thrilled about the wellness and health benefits, but they just were not prepared for the implications that this would have on their facial aging. And now they feel physically younger, but still they look in the mirror and see somebody who's older. And studies have shown that patients who undergo massive weight loss can look up to 5 years older.
It's such a cruel irony that you finally get your body and your physique into the place that you want it. And this can be through GLP-1s or exercise or sort of consistent diet, but it does show on our faces often, most, doesn't it?
And often they're so wrapped up in the excitement of their success, and then they're hit hard with this sequelae of facial changes that they just were not prepared for.
Absolutely, and I think that really undermines then self-esteem, going back to sort of what we were discussing with Martin as well. You know, you've put so much time and effort into sort of trying to cultivate this sort of new healthy lifestyle and regime, and only to look in the mirror and be disappointed in the reflection that stares back at you. What are the areas of the face that you see being the most susceptible to volume loss related to weight loss?
So we've got the two facets. We've got the volume loss, the structural or facial shape. That, of course, is a more diffuse volume loss, but most often in the middle of the face. But then we have the skin quality changes that are really pronounced. And
So that's that sort of loss of elasticity.
Exactly. Loss of elasticity is one part of it, but also skin quality from the point of view of radiance, dehydration, and the thinning of the skin as well.
And that's interesting, because I suppose a lot of that is down to the loss of the facial fat as well, which we know is so regenerative and full of all those stem cells that keep our faces looking plump and juicy and youthful. So you strip that away, and then you're sort of left with something that's not as well fertilized in a sense.
Absolutely. We rely on a healthy balance of fat cells in the face and the skin for skin health generally. So it makes a big difference.
And tell me, because I think for a lot of people when they're sort of facing face-related changes, their first port of call is often, skincare. It's topical solutions. It's trying to sort of upgrade their skincare regime to really make a difference to that radiance, that luminosity, maybe the texture of their skin. Is that something that you advocate for? Do you recommend patients getting on a really sort of strong topical regimen, or not strong, but a consistent topical regimen?
Absolutely. It's really the cornerstone of our approach in clinic with the combination approach that number one is always skincare. So most of the patients that we would see would already be on an optimized skin regime, the bare minimum being our ABC approach, which is A for vitamin A or retinoid, B for sunblock, C for vitamin C. So that would be the bare
I love that. I've never heard
minimum.
ABC before, but that's a very good way to remember it.
Yeah, so that would be the absolute non-negotiable for all patients, if tolerated, of course. But then there's more sort of state-of-the-art advanced technologies. One that comes in mind in particular for this presentation is, for instance, the elastin technology of Tri-Hex, which is, for instance, the restorative skin complex. We use that a lot with these type of patients. And it's this really innovative formulation that gets rid of old and damaged collagen to make space and room for new collagen growth.
That sounds amazing. So it's sort of almost thickening up the skin and sort of giving it that resilience back again.
Absolutely, and there's also this brand that I'm very interested to learn more about on the table.
Yeah, exactly.
Some really exciting new innovations coming as well.
I've been using it on my face for the last month in very targeted areas, which means everywhere. And what about treatments? So building on topical skincare, because we know that sadly there's no silver bullet and none of these single things in isolation really makes a difference. What about when someone's faced with you in clinic? What are the things that you might be reaching to, products, devices, that are going to help them to restore that sort of natural facial volume?
Yeah, so treatment planning is very bespoke, and no treatment plan is quite the same. But we have.
And I love this because you also have your membership approach, don't
Yes.
you, as well?
We've
Can you tell us
got,
about it quickly?
Yeah, so we've built our clinic on a members club approach that really, it's about a lifetime journey, but all of our treatment plans, they go across a full year where our patients, they come in once a month, and often we have very deliberately planned and staged each treatment to optimize this next step of their treatment plan, and it's in a sort of private members club structure.
I love that also because you're just taking the guesswork and the thinking and the organisation out of it for the patient, which can be the biggest battle of all. But sorry, you were telling me about the approach to volume loss.
Yes, so treatment planning, of course, is bespoke, but there are some general rules that are helpful. So the first thing is to consider the amount or severity of the weight loss and how severely it's impacted their facial changes. So I think of it as mild, moderate, and severe. And for mild cases, often a regenerative biostimulator like Sculpture alone is enough.
Okay, interesting.
Moderate cases, often we may increase the amount of sessions, for instance, of sculpture, but also add HA injectables in a more localized area that may have been affected. And then we've got severe cases that would require sculpture, but a more full face approach to HA injectables as the first step in a combination approach. But then it also depends on at what stage of their weight loss journey have they presented, because unfortunately, most of our patients present after the fact that these...
We're not quite in the mindset yet of going, I'm going to get my skin and my facial anatomy into optimal condition before I go and lose all the weight. That's one thing too many.
Exactly, and I think there often is this excitement of losing the weight, whereas in the middle of that journey, had they come to see us, in my experience, the outcomes really do improve.
That's really interesting. And tell me a bit about sculpture, because it's definitely having a moment. And correct me if I'm wrong, I think it's 25 years now
Yes.
since it sort of was first created. It was very, very popular as an injectable product for treating volume loss in facial sort of volume loss anyway, in patients with AIDS, HIV positive, who had very severe volume defects, which is fascinating. But it's also in that camp of more regenerative treatments, which I think people are very interested in, you know, the things that can stimulate our body to produce its own natural resources and its own natural scaffolding.
Yeah, so Sculptra is the original regenerative biostimulator, and it's not quite the same treatment as it was 10 or 15 years ago. We have evolved our protocols and the way that we mix it up and use in which areas. So it is a very well-studied product. And what makes it so unique is that it's a regenerative biostimulator, meaning that not only does it stimulate collagen, but it actually targets all three layers of the skin, so epidermis, dermis, and hypodermis. So it also regenerates elastin as well as fatty tissue, but it's not truly a volumizer in the sense as HA injectables or fillers are. It's more a diffuse, very undetectable and natural way of replacing lost fatty volume, but we can tailor it and make it bespoke by the way we inject it.
Like different techniques that enable to have a different effect depending on
Exactly.
what the patient's concerns are with their skin.
Exactly. So it is really the common denominator that I use most often for all these type of presentations, but also non-weight loss related patients.
And it's interesting because you said it sort of stimulates collagen. It's type 1 collagen it's stimulating.
So generally speaking, we have seen from the studies that it stimulates type 1 collagen by up to 66% in 3 months, which is really impressive.
That's amazing.
Yeah, absolutely.
Yeah, that's a big figure.
And it's a really long-lasting, sustained improvement over 24 months. And that's the traditional evidence that we've known about. But then we have newer studies that have shown this more regenerative ability throughout more layers. So actually, we have also seen improvement in the quality of collagen, and then a 24 to 34% improvement within 9 months of the quality of elastin and the thickness of the skin overall, including the thickness of the fat layer.
That's amazing. Yeah, the fat sort of research is very new as well, sort of actually being able to stimulate the fat cells now. And I think that's a really nice new adjunct in aesthetics as well, because for such a long time, fat has been quite demonized. And I think now we're really looking at healthy fat preservation, healthy fat stimulation, and really understanding the role that it plays in keeping the body in that perfect equilibrium. Tell us a bit about how you're applying it, sort of how many sessions, how regularly do you need to do the treatment?
So generally speaking, we use Sculptra across the board, and it's usually 2 to 3 sessions, 1 to 2 vials per session, depending on the presentation and each bespoke treatment plan, roughly about 6 weeks apart. But then in terms of long-term maintenance, just 1 session every year is enough to keep it going. But when it comes to rapid weight loss, perhaps the more moderate to severe presentations, sometimes we'll go off-label and utilize more sessions or change that protocol accordingly.
Yeah, it's interesting how you've both said off-label, and I think, again, just sort of being under the supervision of somebody who knows what that means and does it in a responsible way is also important, isn't it? With the sculpture, how are you sort of seeing your use of it to change? Because I remember when I first started in beauty journalism about 15 years ago, and we would talk about sculpture, and we would always talk about it in relation to the more mature patient, and it would always be about, sort of very crepey skin and sort of older, more tired complexions. Are you seeing a younger demographic come through for this now?
Yeah, absolutely. We see a younger demographic that's much more educated and interested in this preventative collagen banking approach. And sculpture really has a place throughout all of these age groups. So we've got different protocols or archetypes, as we call them, which are essentially injection techniques. And there is one in particular that's called the youthful glow that doesn't necessarily target volume loss or laxity if that's not required, but actually it focuses more on radiance and hydration, and even sometimes we can see textural changes. So you can really use it in a very bespoke manner for preventative measures when needed. And then it's a more light-handed treatment plan as well.
That's really interesting. And tell us about the combination approach, because you also mentioned sort of other energy-based devices and products that you're integrating. What might those be, and at what stage would they be fitting into the patient's journey with you?
Yeah, so again, this is very much on an off-label approach. But what we like to do in clinic is for those patients who have moderate to severe laxity, jowling, or sagging, we would combine not only just the injectable combination from a layering point of view, so we layer, for instance, over a number of sessions, different types of HA injectables with Sculptra, but then also we move into the energy-based devices. So the way that I like to plan it is, for instance, we would start with Sculptra to activate and almost wake up those inactive and senescent collagen cells that have been asleep for some time, so that we then, in the next few weeks, hit it with an energy-based device, such as SoftWave, which we use very commonly in clinic, which is ultrasound-based for heat-based stimulation and tightening. And the way I think of it is when we combine them in this particular time frame, it's like 1 + 1 = 3. So they feed into each other, and then you get an optimized outcome at the end.
Amazing. That sounds like a very intelligent approach, and I can see it having great effects. I need to book in and see you immediately, as soon as I'm able to, after delivering this baby. Thank you very much,
Pleasure.
Anna. Fascinating as always. Our third and final speaker is Mr. Georgios Orfaniotis, who is fast becoming one of the most sought-after facial plastic surgeons in London, and really pushing the envelope, I think, when it comes to technique and also aftercare. But George, tell us, maybe it's the Kris Jenner effect, but all of a sudden it feels like there's a real fascination in facelifts. And where's this coming from, do you think?
Yes, thank you. It was well before Kris Jenner. And by the way, Kris Jenner's results are not the real results, what we see. It's the product of a lot of, filters and professional makeup artists. So, because honestly, if somebody expects to look like a Kris Jenner on the pictures that we've seen, probably we set unrealistic expectations.
Yeah, and you need to be very mindful of that.
So, but I think there is two main factors that contributed to the rise of facelift as a more acceptable sort of treatment and less of a taboo these days. The first one is, the patients are looking to look better, they feel better, they went through this wellness journey, and now, as Anna mentioned, and also Martin, they face the reality of their face looking a little bit saggy, a little bit lost the contours, lost the definitions. And when the body feels great and the brain feels great, and you wake up in the morning and you see all this, feel this energy, looking at yourself in the mirror, you get sometimes let down by this laxity. And let's face it, following lockdown, seeing ourselves more in the screens, and we all been very critical about the way we look. And how this projects in other people, because the world we're living is also ageist, and sometimes people, they go to jobs and they feel like, you know, they look a little bit older than the people that they do the same job like them. And all these things have contributed, and also the fact that the techniques have evolved so much over the last 10 years that we actually see results that we like. We don't see these pulled Hollywood faces that they look completely distorted and everybody was like, oh my God, you know, I will never have a facelift.
Well, I think that's a lot down to the techniques that you're using as well nowadays as well.
Exactly.
Back in the day when they were just pulling the skin tight and you looked like you were stuck in a wind tunnel.
Exactly.
I mean, nobody wanted that.
And all these techniques that have been developed in order to give people results that they are not detectable, they don't look surgical, they look natural, and also they heal in a way that you know, nobody can notice.
So tell us a little bit about these techniques, because you do something called the deep plane facelift, which is almost the gold standard now, I'd say, when it comes to sort of repositioning the mid and lower face. Can you explain to us why that's different from that wind tunnel effect we were getting?
Yes, the wind tunnel effect was possibly due to the fact that there were some areas in the face that were pulled, that they were easy to pull. So, for example, let's say that, you know, you want to pull your mid face up. This doesn't really, you know, respond to the traditional techniques where they were lifting the skin or you were trying to put some sutures in the SMAS layer, which is this muscular layer under the skin that is responsible for the sagging. Therefore, we realized that in order to get this effect of a natural restoration of the tissues to where they were originally dropped from, we need to do further release. And this release needs to happen in a deeper area, hence the deep plane terminology. So now we are not lifting the skin, we are lifting what we call a composite flap, which is like the skin is attached to the underlying deeper layers, and we work deeper. And all this uniform sort of freedom of the facial tissues has led to simulating the vectors of aging. So we can reposition the tissues where, you know, they came from in a vector that they dropped. And
so it's the most natural repositioning of that facial
Correct.
anatomy, which is almost incongruous, because when you talk about your technique, it sounds very advanced and very complex and involved, but actually you'd almost argue, and I would argue, having seen a lot of the befores and afters, that it's a much more subtle, undetectable result versus just, people always go, it's just this bit here that I want to tweak. And
Absolutely.
they lift it up, but that doesn't make the difference in the same way, does it?
Well, you know, the irony is that in order to get these natural results and this subtle improvement, you need to do a lot of work on the face. Because if you end up pulling what is easy to pull without releasing the most difficult areas, you will have this, you know, lateral sweep deformity. So you see like these faces with a line, that there is obvious that they had a facelift without touch. So lateral pull is an absolute no these days. So we know that the face is falling almost vertically. So we restore the vertical vector. Therefore, I think, you know, there is a fundamental difference on the technique, and it's a catch-22. Has the technique brought more patient interest into that, in the facelift, or has actually the technique has evolved because the patients were more interested? I think it's a combination of these two.
Yeah, I agree with you. I think it's that sort of combination effect. You also have a very global approach when it comes to the facelift. So it's not just the deep plane technique you do. You have some adjunctive procedures as well, things like blepharoplasties,
Yes.
lip lifts, neck work. What does that do for the overall effect, and why is that an important approach to take?
Yeah, when you assess somebody who's coming to see you, you need to make sure that you give them a balanced result. So there is no areas on the face that they look totally off. For example, you cannot go and perform a facelift on somebody who has a very droopy brows. You look like you lifted the face and the brows are not lifted. And there is adjuncts such as blepharoplasty, you know, fat grafting is very important, especially when we're talking about people losing weight. But again, less is more. So the younger the patient, the less the treatments that you need. And therefore, you always need to target the treatment. And sometimes there's scope of staging procedures. Somebody may, not be keen on a facelift straight away, so they want to do their eyes first. And that's a good introduction to cosmetic surgery. It's a less invasive procedure, quicker recovery, and they see if they enjoy the results and they didn't have any problems with the healing, then they can move to the next level.
You spoke about two things there that I want to unpick quickly. The first is the fat grafting and what sort of a place that plays, and also conversely things like fat removal. We saw a big spike in things like people removing buccal fat. So
yes.
why is fat so critical in the face that has lost the volume, and how are you going about preserving it in a way that it still looks natural?
Mm-hmm. Fat is definitely critical, and it is this layer of tissue that when we lose it, we see that what we call a gliding plane. So essentially you've got the muscles on the face that they move, and in order to move smoothly and without looking that they are pulling the skin, you need this fat layer on the top of the muscle in order for the muscle to glide. When you actually lose this layer, you start seeing, for example, the wrinkles around your orbicularis muscle, the crow's feet. You start seeing, the wrinkles around your buccal area. And, you need to replace the fat when it's lost, but not everyone needs it. So the approach, again, is tailored to the patient. A young 45-year-old patient doesn't necessarily need fat, but a patient who went through a weight loss journey is probably is the ideal candidate for it. And the techniques about the fat have evolved, so we are looking at more sophisticated sort of process of the fat cells. And, the results are much more predictable. So, yes, fat is a great adjunct.
And you mentioned the sort of younger patient there as well, and I'm interested to know who your ideal patient is, and also if you are seeing that slightly younger patient come through your door now.
Yes. Well, ideal patient,
yes.
There's no age for the ideal patient, although, you need to make sure that you don't start operating on people at the 30 years old, because you do have requests these days from people that they're relatively young. However, early 40s, I have operated on people. It depends. So my ideal patient is the patient that has started a journey into wellness, have seen the specialist, and they have managed the hormonal sort of aspect of their health. They are reached a plateau with their weight. They don't necessarily need to go on a weight loss journey. As long as they're happy where they are, the important is, of course, not to be overweight and lose this extra weight. But again, not everyone wants to be skinny. And I think when the patient has reached this level where they're happy with their body, they're happy with what they have, and generally, emotionally and psychologically, they're in a good place, facelift can be a celebration of all this. And I love.
That's a nice way of putting it.
Yeah, it really is, because I see my patients after the facelift. Of course, they're all coming and they feel, stressed about it. It's a major surgery. Let's face it, like people that they are offering lunch on facelifts and, a 2-hour facelift that you can have it.
That's crazy.
It's
the ultimate investment. I mean, when we're talking about sort of health and wellness, it is that sort of big investment purchase.
It's a life event.
Yeah.
It's a life event.
Absolutely, and you need to go into it with your eyes open.
And optimization of your health before that is a key aspect for a good recovery. And the more we do, the more we understand that, there are certain things that we cannot control. For example, inflammation in your body. You need to reduce the inflammation. You need to ensure that you have the necessarily body muscle mass to cope with a hypercatabolic state after surgery. And also, you need to ensure that you are psychologically in a good place. And that's very important, because we all make rash decisions sometimes. People might have, somebody might have a divorce, somebody, can have like something that happened in the family. So they all trying sometimes to find a way to get out of this situation.
A facelift isn't the solution.
It's not the solution. No, it's definitely not.
No, yeah, I mean...
It can be a recipe for disaster, really.
Well, not in your hands, hopefully, but I'm sure you talk a lot of people out. You touched on things like the sort of importance of preparation, but I want to sort of end on recovery as well,
Yes.
because I think that's a really interesting sort of facet. You know, people who have maybe experienced sort of weight loss, but fundamentally people who have undergone surgical procedures, because you're doing some very interesting sort of biohacking therapies and adjuncts again to that patient journey. What are the things that you really recommend?
Yes, I mean, there's lots of things. Of course, beforehand, I do have a doctor who does a consultation and gives preoperative advice. So we do recommend zinc, for example, and vitamin C, skin optimization, and stopping sugar, stopping alcohol, reduce inflammation, and all this sort of thing. And afterwards, it's extremely important to have good nutrition, because you're struggling after a facelift. So I give people protein. Protein is a key element for the recovery. The Americans have got a lot of, published a lot on this subject, and it's very overlooked, I think, in the UK, how important is protein. And you need to have supplements, because, otherwise you won't be meeting the requirements for your recovery. You need also some other help in terms of optimizing the tissue healing, such as hyperbaric oxygen. I love hyperbaric oxygen. I think there is a little bit of a hype on this, but there's definitely evidence, and I have seen the difference on patients that they had it on the healing process. Red light therapy is amazing. Manual lymphatic massages are also very important to shift all the swelling. So there's so many things that you can do, and I have taken an approach of, very active approach on guiding my patients through that process, because I feel that sometimes we're missing out, and the patients love it. The patients love to be involved.
I think be involved and also feel like exactly that they can be a part of, and they
Absolutely.
can play a part in their recovery and their end result.
And they are. And let's face it, it's difficult. I see patients now that, I ask them, do you exercise every day? My patients are really fit patients. This picture of a facelift patient, smoker, a bit older, this is gone with, skin that is damaged. I see people 47, 55, female successful entrepreneurs. They've done it all, and now they want to have, a little facelift and a little facelift. They want to have a facelift.
Their life event
they want to
facelift.
look good. They want to look good. They've been through the journey, across here the panel. And they have seen the limitations sometimes of what the non-surgical treatments can offer, and they've decided that it's time. And it just this moment, it hits you, and you know that this is the time. And you can talk about it for years and years and years, or not talk about it, or criticize other people that you're having it. But when this moment comes, and you look yourself in the mirror, you say, okay, I need to do this.
Yeah, exactly.
And
you can never predict the future, can you? So
Yeah.
I think it's good to always keep an open mind about whatever options might come into your life in the future.
And that's great,
Yeah.
because then you know that you've got the right patient coming through the door.
Agreed. And I think that's the most important thing, that partnership, the right doctor, the right patient, the right
And
partnership.
again, partnership is key, because we are very lucky. We operate in London, where there's experts, in London in the UK, where there's experts for every little thing. And I think, partnership with people that they do offer high-class services, like Martin or Ana in the in the wellness and aesthetic industry, it's key.
Agreed. I think you've all done such a fascinating job at explaining all of this to us. And thank you, George, as well, for rounding that up so nicely and so succinctly. It's been so fascinating to me to listen to all of you and all of your different approaches. And I think what's been really empowering is to actually bring these conversations. I think weight loss is sometimes spoken about, whispered about behind closed doors, but I think each of you has really dispelled a lot of misinformation. You've really got us away from that concept of the trends and the fast fixes towards trying to sort of get to the optimal weight, and ultimately showed us the solutions to get our body into the most optimal and sort of confidence-enhancing version that we can get it into. So a big thank you from me. I don't know if we
Thank you.
have time for questions. No, I think there's no time for questions. We spoke a lot this morning. All of our speakers will still be here afterwards, so a big thank you for joining us. And anything that you'd like to speak to them about, do sort of corner them quickly afterwards. It's been amazing to have you all here. A big thank you for joining. And we'd love to see you at more events, so do come along. We've got another one here at Annabelle's, I believe, in January. We've also just announced our Beauty Triangle Festival in January. There's more information on the back of your programme. We have an early bird rate going for the next week, so do take advantage of that. It's a full day of consultations, treatments, talks just like this one. We'd love to see you there. And a big thank you to Annabelle's, as always, for hosting us so very beautifully. And enjoy the rest of your day, everybody. Thanks to our Beauty Triangle.
Thank you, Francesca.
Thank
Thanks,
you.
everybody.